most famous physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Neck cracking. Is it safe? See this study. Brad's found a great study on kind of the breakdown of some of the injuries that may happen with neck cracking. Am I giving it away, Brad?
No, that's fine. That's fine, Bob.
We'll
but yeah,
get into it. By the way, if you're new to
Right.
our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. If you have a chance, go to our website, bobandbrad.com, because we're always giving something away.
Sure.
It'll also be pinned to the top of the page on our Facebook page. If you want a short version of us, go to Twitter, or Instagram, or TikTok. What we're giving away this week is, right, Mike, the TENS unit? Right. We're going to, I think, a couple of these TENS units away. Really great for pain control, especially chronic pain. Get you off those opioids, at
Right.
least maybe decrease the use of them.
Right.
So great option for that.
All right. So, Bob, the old neck cracking. We know, people out there. I have some people I know that they crack their neck just for the fun of
Constantly,
it,
right.
because they make the noise and they do it in front of
Yeah.
other people just to freak them out a little bit. It's also very commonly done with chiropractor. There are some osteopaths, physical therapists.
In some countries, we do high grade mobilizations. They don't really call it. Yeah.
But we can't. I mean, I don't know any do.
Right.
But I've been to a course and they said legally, I guess a physical therapist can do it.
High grade mobilizations. Yeah, they can.
Grade 5.
Grade 5,
which
yeah.
we'll get into. So neck adjustments, are they safe? I've been to the chiropractor many times when I was younger before I got into therapy, and I would go there for a back problem, and they would crack my low back, and then they would, or adjust, I should say,
Sure.
or manipulate my thoracic spine, and they'd say, well, we got to do the whole spine. And then I'd lay there, and they'd grab your head and just relax, and I just hated it. It's like, oh, I'm relaxing. And it never hurt, never had any problem. And then what made me think about this is when I became a therapist and I was working in a nursing home, and one of my patients who was a resident there had his neck manipulated and there was a severe injury as a result of it. That's
Sure.
what put him into the nursing home. And then I thought, if this is a possibility, I don't want to do that because I can fix my own neck
Right.
with exercises quite well with the knowledge I have now. So I think that's an option that should be considered by people if they want
I think
to.
it's like anything, there's risks involved. Like there's risks involved in all surgeries,
Right.
and risks involved in some treatments. And you should know that there are risks, that, it's not just 100%
Right.
safe.
'Cause
We're not trying to get down on chiropractors or osteopaths or
but know what's going on.
know what's going on. Go in
There,
with the
people
eyes
who
wide open.
manipulate and adjust necks are highly trained.
Yes, they
know
are.
what they're doing, but it's not 100%.
Right.
And let's look at the neck and see what the tissues are that are of concern. You'll have to zoom in for this,
You
Mike.
need help, Mike?
Yeah,
Brad?
if you hold that. Here we got the spine and the muscles and stuff. There's no issue. You're not going to pull a muscle or rip a muscle with it. But if you look at the spine, we have the facet joints at every level, and that's what makes the pop, by the way. It's one of the joints cavitates, and the nitrogen goes from a liquid to a gas, and you hear that pop, and, people...
A release of gas, yeah.
Yep. Then we have the spinal nerves.
And these are cut off. They actually keep going into the arm.
Right.
So
But a big thing here is the artery. Okay, that there's two of them, one on each side, and these arteries go up through the spine and into the brain, into the circle of Willis, which is another story. But
Right.
it's critical for brain function, and if that's interrupted, that can cause a problem.
well, look at what happens when I'm twisting this neck here. I don't know if you can see that, but you can see there's stress on that artery.
Sure.
So and there is in a very, very small percentage of cases,
Right.
you can actually, it can cause a stroke or stroke-like symptoms.
Right.
Mike, our camera person, was just talking about this week, where he knew of a young girl that this happened to in our little town of Winona.
Sure.
So
So let's look at how often does it happen. Now, I found a study that actually goes through some actual incidences. It's from the JRSM, which is a Journal of Royal Society of Medicine. This study was done in July of 2007. So I'm not going to say any more about it, but look this up if you're interested in finding out what can happen. They have a list of it's, I believe, 30 different injuries as a result of spinal manipulation. Most of them, not all of them to the neck, but a great number of them to the neck. They tell the injury, who did it. Some were chiropractors,
Very
some were
well delineated. I mean,
right. It's all
yeah.
spelled out. So it is something that you may be concerned with. And if if you have a good relationship with your chiropractor and you trust them, it's no big deal.
Same with your osteopath or anybody else. But
Right.
and it also is another reason why you should take pause on cracking your own neck, though.
Yes.
You know what I mean? Unless you
Right.
want to do it safely, like we showed the other day.
Yeah, and that's really not
That
even
was a net. That was not an adjustment.
right, because to crack your neck when you get
You're
it
doing
done.
high velocity.
Right. It's a grade 5 manipulation, high velocity, low amplitude. It takes a lot of training.
Right.
A lot of training, and that's what these professionals
Right.
have.
You don't want to be messing around. And of course, there's certain cases where you don't want to have it done at all, like rheumatoid arthritis, where the ligaments could be loose and
Right.
there's-
And the professionals know that.
they all know that.
They're very
right?
well aware of it.
So,
So very good. Little
trying to keep you educated out there.
exactly.
All right. Thanks for watching.